Well, people tend to be a lot more active for a lot longer time now. The expectations of people in their 50s and 60s are really not the same expectations that we saw even 20 years ago. I've been in practice now 19 years, and even during my residency. So you have the expectations of most of the patients that we see, motivation to be very active. So you can see pretty significant athletic injuries in a population that tends to be a little older now, and yet very active. You can actually do significant reconstructive procedures with the use of minimally invasive techniques. For example, I would say that more than 95% of all the rotator cuff surgery that we do is arthroscopic. And that is a spectrum of disease, from the very simple decompressions where you're shaving a little bit of bone to massive rotator cuff repairs where you have to mobilize tissue and really repair the whole tendon footprint in the shoulder. With the advent of techniques in arthroscopic surgery, most of the procedures that we do in the shoulder, both outpatient and minimally invasive. Most of these patients that come to see us, the goal is to get back to the previous level of activity they had. These fixation devices that we have now in terms of anchors and special types of sutures that are very strong, we're able to rehabilitate people a lot quicker now than in the past. The outcomes are such that we have a much higher incidence of people going back to that level of activity or very close to it.